Good morning, everyone, and welcome to today's EPF breakfast briefing. My name is Elena Balestra, and I'm Membership and Capacity Building Officer at EPF. Today, we're going to take up a challenge to talk about a quite technical topic, HTA, in a very friendly and simple way. Before we dive into today's topic, I kindly remind you that breakfast briefings are interactive. Therefore, you can send your comments and questions to bb@eupatients.eu, email address that you will also see appearing at the bottom of your screen. Last but not least, you will be able to see this video on our YouTube channel later on today. Now that we took care of the housekeeping rules, I'm happy to introduce you to today's speaker, EPF Program Manager Valentina Strammiello. Good morning, Valentina.
Good morning.
How are you today?
Fine, thank you. It's a bit cold, but it's okay.
It's winter. Valentina, so today we're going to talk about health technology assessment and to discover a bit more about this technical but very interesting topic. Valentina, can you tell me and our audience a little bit more about yourself and how you became an EPF HTA expert?
Sure. As you said, I'm program manager at EPF. I've been working for EPF for almost 5 years now. And I started working on HTA in 2015, early 2015. It happened really by chance because someone had to take care of this policy dossier, and I volunteered because I usually like to take challenges. And it was really a challenge because I didn't know anything about it when I started working on this topic. Soon after I took over, I also started representing EPF in the UNETA Stakeholder Forum. And so in that capacity, I was representing both EPF and the patient community as a whole.
So you mentioned UNETA. Can you explain a bit more what UNETA is?
UNETA is a joint action, which means it's a project financed with the EU funds and co-financed with by member states, actually. So partners of these joint actions are not private partners, but member states. In this case, HTA agencies.
I see, but we'll talk a bit more about HTA agency and let's say the institutions a bit later,
Sure.
But let's go back to the basics. And what does it really mean, HTA? And could you give us 2 examples of health technology?
Sure. HTA is needed to measure the added value of a new technology in comparison to existing standard of care. And it's a multidisciplinary process that summarizes aspects like the ethical, economic, safety ones. And that's why it's so complex, because there are so many aspects you have to take into account when you conduct the assessment. If you want to have a few examples, I can say first, the term technology might lead to think that it's about IT tools or medical technologies. Instead, this term refers to any aspect of healthcare. So it may refer to organizational aspects, pharmaceuticals, prevention programs. So I would say, if you want a couple of examples, surgery could be an health technology, as well as a diabetes prevention program.
I see. So therefore, if I understand correctly, a thermometer or even a very complex medical procedure are both health technology.
Even a wheelchair.
Even a wheelchair. Okay. So things that we really see in our daily life, right?
Sure.
And why do we need to assess health technology, and who does that?
As I said, it's needed because it helps us to understand whether new technologies entering the market are really worth the investment of public funds. And who does that? It's mainly national entities, which are HTA bodies. And if we look at the European context, there are really diversities, because there are, in some cases, independent bodies conducting HTA. In other cases, can be bodies that are controlled by the governments. And this may lead, of course, to different assessments, different results, of course.
And is it compulsory for each and every new healthcare technology to undergo such a process?
Not really. That's why in HTA there is also a scoping phase where the technologies and topics to be assessed are identified. For example, this is a big problem when it comes to medical technologies. A lot of medical technologies enter the market every year. One estimation is about more than 1,000. So it would be impossible for HTA bodies to assess all of them. You need to make a selection.
I see. And how this selection is done?
It's conducted usually by the HTA bodies themselves, but we as a patient community also advocate for involvement in this process because we have the possibility to provide really good and critical information on what is really needed from a patient perspective.
Yeah, and we will see about the patient perspective in a moment. But let's focus now really on the process itself. We say that it's a multidisciplinary and quite complex process. But what are the criteria in health technology assessment?
Here we need to clarify because a full HTA involves 9 domains. Including, of course, the existing standard of care, the characteristic of the new technologies, the safety, clinical effectiveness, as well as ethical aspects, social and patient aspects, cost effectiveness, even legal aspects. So there are so many. Most often, at least recently, HTA bodies decide to conduct rapid HTAs, because it's of course a faster procedure than considering all the 9 domains, which is usually called full HTA.
I see. And are also patients and social aspects took into account when doing HTA assessment?
In a full HTA they are, and we feel they should be always included even in a rapid HTA, because this is the only domain that can capture the patient perspective and can capture quality of life issues when it comes to the impact of a new treatment on a patient's daily life.
I see. Well, definitely patients are a key stakeholders, but what are the other key stakeholders in such a process?
Of course, healthcare professionals are considered key stakeholders, as well as industry, both pharmaceutical and medical devices, and payers. In this case, we have both the national healthcare systems and also private insurance systems, as well as we said patients, of course. And I would say in the HTA environment, we have always to take into account that after the assessment is conducted, then it's the role of decision makers to finalize the process and proceed with decisions on pricing and reimbursement. So I would always take their perspective into account as well.
Sure. And when this process is over, and for example, if it wasn't a successful one, what is going to happen? What is going to happen? Can we find this, if it's a device, can we find it on the market, or if it's a procedure?
A positive assessment doesn't necessarily lead to the reimbursement of the product, and so for sure maybe it will stay in the market, but not necessarily it leads to reimbursement decisions. So this is decisions that stay with decision makers at national level. But in principle, yes, after a positive assessment, the product should be available for patients and citizens and be reimbursed.
I see. Well, we mentioned patients, so why HTA does it really matter to patients?
Patients are the ultimate users of health technologies, and therefore they should have a critical role in the HTA process. But we have identified also some other reasons why they are so important, and it's because the decisions made on health technologies have an impact on quality of life of patients and citizens. Of course, they provide the opportunity for new technologies, innovative technologies, to be available to patients. So we expect them to improve their life, their quality of life. Another point I would say is that HTA can also help disinvest from those technologies that are considered obsolete or not providing high quality of life. And last but not least, I would say that also the role of patient organizations is fundamental, because they can coach patients, they can provide information, and also advocate for better patient involvement in HTA.
So now that we understood what the role of patients, what HTA means, and how the process works, let's focus on the competencies. And what role does EU play in this area?
EU has so far co-financed a number of research projects on HTA, and at the moment it's co-financing the already mentioned UNETA, Joint Action 3. UNETA is, as I said, the joint actions, and we are going now through the third round of this joint action. So this is on the projects and program side. On the policy side, the European Commission has initiated last year consultation on HTA, which will result in an impact assessment report. We are waiting for it to be published early next year at the latest.
So we'll know something the quarter of 2018, more or less.
Hopefully.
So if I understand correctly, the national level play a bit more of an important role so far. Can you tell us a bit more?
Of course, it's HTA bodies acting at national level, conducting the assessments. It's also decision makers acting at national level, making the final decisions. That's why we say at the end of the day, it's still the national level, the ones that plays the most important role. UNETA is there to make sure that there is more harmonizations around the methodologies and technologies to be assessed, to avoid maybe overuse of resources at European level, to make sure that some assessments can be reused in other contexts, in other countries.
So it's mainly providing guidelines and supporting, let's say, the member state and the local agencies.
And also making sure that there is collaboration among different HTA agencies.
I see, which is definitely an important role. Let's now focus on us, on EPF. What is EPF role on HTA, and what EPF is doing regarding this dossier?
We are active in several fora, like the HTA network stakeholder pool, as well as in the HTA International Patients and Citizens Interest Group. And we also advocate for better patient involvement in HTA, as I already said. So it's really an advocacy work we do, but at the same time we work with our membership to make sure that patients understand what HTA is, how it can impact their quality of life, and also we try to coach them when it comes to assessments, because this, as you see, it's a technical topic, and it's not self-evident that people who get involved in this process understand what it is about, how they can contribute.
Yeah. And as EPF, what do we recommend in terms of how to involve patients in such a process?
For us, what is fundamental is early involvement in the process. So I would say since the scoping phase, when topics are selected. And if not directly involved, patients should be informed overall the process till the very end. So what is important is to make sure that patient involvement is included in the timeline of an HTA process. This is not usually done in a proper manner, in my opinion. So what it happens in most of the cases is that HTA agencies approach patient organization providing a very short notice to identify a patient for an assessment. This is not very making our work easier.
Yeah, and I think also the language, the way the reports are written is also very important. It should be.
Sure, we also advocate for lay language reports. And that's why as EPF we try to contribute by producing leaflets, material that is accessible to our membership and to the whole patient community.
Yeah, Definitely, and this is again exactly my next question. If I'm a patient organization or a patient and I would like to find out more about HTA, both on a national level or a European level, where I can find such informations?
The website of the HTA International provides a repository of material with templates on patient-reported outcomes, information on HTA, and but there are also journals and through EPF also it's possible to get to know more about this topic. We also have a web page on our website where you can find our own reports, our leaflets, and of course we are always available to provide information that is not available on the web.
Definitely. Let's move on a bit more on the, let's say, political part. At the moment, what's at stake on HTA at EU level?
At the moment, the main priority is the launch of the legislative initiative on HTA. In fact, here the purpose is to build a structure, an infrastructure to allow collaboration at EU level on HTA. And so this is the most important topic for the moment. We are contributing and also trying to monitor it. We will follow up with our membership as soon as we have further information.
We'll definitely do that. And what are next EPF actions on this policy dossier?
In the short term, we are going to produce a briefing on HTA, which will be made available soon, at the end of this year, hopefully. And in next year, we are planning also to produce a position paper on HTA. This is not written in stones, but it's of course preferable as there will be this legislative initiative. We think it's also needed.
Too important to say our say.
Yes, of course.
We're getting towards the end of this breakfast briefing. Valentina, do you have any final message for our audience?
My final message is rather an invitation to send us any testimonial patients have. Maybe many of them have been involved in HTA assessments and we are not aware of these experiences. For us it's important to collect both positive and negative experiences because we can reuse them to channel political messages to HTA agencies, EU institutions, and also build recommendations on how patient involvement should be conducted.
So you heard Valentina. If you have any story that you would like to share with us, you can write at bb@eupatient.eu to tell us your positive and negative stories about HTA. Valentina, thank you very much for staying with us today and for sharing your knowledge. And thank you for being with us this morning and watching either this video on YouTube or watching it live. I would like to let you know that this video will be available as from this afternoon on our YouTube channel. And if you are watching this video on YouTube and you liked it, thumbs up. And if you haven't subscribed to our YouTube channel, please do so in order to be updated on the latest videos that we will be uploading. A special thank to my colleagues in the backstage for making this live possible, Sarah and Zilvinas, that took care of all the technical part. These breakfast briefings ends here, but we will be back next week on the 7th of December at 10 a.m. to discuss the campaign EU for Health. Thank you very much for watching and have a good day.